Hello everyone, Dr. Divya here. So in today's session of yoga therapy, we are going to study a new unit which is known as digestive and excretory disorders. So in that part, we are going to study digestive one, which is the dyspepsia. So let's begin the session. Dyspepsia is another word for indigestion. People with chronic indigestion often reports the feelings of stomach pain, overfullness and bloating during the after eating. Other common symptoms include the acid reflux, heartburn and excessive the burping. These symptoms resemble such as the peptic ulcer disease, but when tested only 1 by 3 of people will have a stomach ulcer. The other 2 by 3 will have the functional dyspepsia. A functional dyspepsia is actually the ongoing problem with your bodily functions that cannot be explained by physical causes. You have the symptoms and doctors can observe those symptoms, but cannot find any mechanical reason for them. Gastrointestinal disease are often functional rather than the structural. Doctors don't always understand why they occur, and it may be that the brain and the nerves are involved. So what are the symptoms of the dyspepsia? There are a lot of things. First one is the epigastric pain. This is a pain in the upper abdomen under the rib cage. Okay, this region called the epigastrium is home to your stomach, small intestine, pancreas and liver. Second one is the bloated stomach, feelings of uncomfortable pressure or fullness in your belly, especially after eating. And the third, it is called as the early satiety or loss of appetite, feeling full very quickly after or during eating. And another aspect of it is the heartburn. This is a burning pain in the region between the stomach and the esophagus, usually due to the acid reflux. So when the acid, it's your stomach, so when the acid reflux, your heart feels a little bit heartburn sensation you can feel. So acid reflux, stomach acid causes up from your stomach through your esophagus, leading to a burning sensation and often cause to a sour taste in your mouth, nausea and vomiting as well. In severe cases, fullness and loss of appetite may develop into the actual nausea or vomiting. So what causes functional dyspepsia? The term indigestion assumes that something is going wrong with your digestive process. But this could be a lot of things. Doctors doesn't have clear answers. So for what causes the functional dyspepsia? But they have some suggestions. Some of these include, you can say, impaired stomach. Second one, it is the accommodation emptying. Third, it is normally the stomach is supposed to relax and expand to the accommodate the food. But in some people, this function might be impaired, leading to the constant full feeling. This signals that tells your stomach is actually to empty to food into your small intestine, may also be impaired, which is the gastroparesis. This can cause food backup and gas to build up and bacteria to breed too much while food sits too long in your stomach. So for example, you can see if the food is outside also, like here and there in the kitchen, when the food is just left, so the fungus will start. So same as in our body, the food if resist, it will cause lot of problems. So food allergies, if you have undiagnosed food allergy, it could be the producing an anti-inflammatory response to your gut. Some people with FT have higher white blood cell counts, which suggests the gut immune system is activated. Some also self-report food sensitivities, particularly to wheat. An allergic response could explain symptoms of nausea, gas, and inflammation. Inflammation could be the cause of bloating and pain. And also the hydropylori, the common bacterial infection, can cause chronic inflammation, which is known as the gastritis in some people, as well as the erode the mucus lining that protects the stomach against gastric acid. H. pylori infection can cause a variety of side effects. So, healthcare providers will test for it where your gastrointestinal symptoms are unexplained. Some people with FT do improve after being treated for H. pylori. And also, you can say that the visceral hypersensitivity. Some people's nervous system are very extra sensitive. Those people might have the physical response to stress or emotional factors, such as tightening and restricting of the digestive organs. Some people may also have the visceral hypersensitivity. For example, you have seen that if some people can eat a little bit of spices, they can get a lot of dyspepsia, indigestion. Many of the people, if the age increased as well, which means that regular expansion and contraction of the digestive organs feel excessive or uncomfortable to them. So, what is the management and treatment for them? So, medication might include the acid reduction. Healthcare providers will often begin by prescribing a short term course of medication to repress or neutralize stomach acid. This will give your stomach lining a chance to rest and repair and reduce the symptom of acid reflux. Common prescription medication includes proton pump inhibitors, PPIs, which is called as, and also the H2 receptor blockers. These will usually prescribed for 2 to 3 months and also re-evaluated by your healthcare provider. You may also try over-the-counter antacids, manage your symptoms. Some people are taking, after eating antacids. But before taking any type of antacid, you should consider first your personal family doctor or your healthcare provider. So if you are using them regularly for more than a weeks, okay? And the prokinetic agents, if something is slowing or impairing, okay, your motility, so the process of moving food through your digestive system, prokinetic agents can help in that. These drugs, these medicines helps to encourage your stomach to empty food into your small intestine without holding on to it too long. And also they reduce the tendency to send food and fluids back up to the esophagus. And there are a lot of, you can say, the therapies which is called as the phytotherapy, by which the different types of herbs, okay, herbal preparation to have been successful in treating some people symptoms. So multi-targeted approaches some people are using in them. I must say you can take those medications under the treatment of the healthcare provider, but also one should remember that there are a lot of practices in yoga also that you can prescribe to your patients, to your subjects, as well as a yoga therapist. So the practices you can tell, like one is the Agni Sara, which is the cleansing practice, which comes in the Shatkarm part, which is a very amazing practice. And also the pranayam, which gives any type of cooling effects such as known as the Shitli, Shitkari, Ujjayi pranayam. These type of techniques is very beneficial for the person, those who have the indigestion. And try types of liquids, more and more healthy liquids, herbal liquids. Okay, and also along with that, the practices like child pose, Pavan Muktasan, and also the practices which gives you the spinal twist, as well as those practices which presses your stomach to release the excessive air, such as the Pavan Muktasan is one of the practice. So these type of things, and also the practices which indulge your core part, for example Halasana, and also Vajrasana, And wind releasing pose, I always say Pavan Muktasana, Ushtrasana, camel pose you can practice, Paschimottanasana, forward bending position in sitting, the practices you can practice. And one more, that recycling, the Supta Baddha Konasana, and spinal twist you can practice in lying down position, which is more helpful. Chair pose, child pose, these kind of practices is very beneficial for you. And other than that, definitely practice these three pranayams which I have recommended to you, and along with that deep breathing practices. So what are the things you should avoid? Avoid large meals, preferring small and frequent meals. Okay. Do not have meals and snacks 2 to 3 hours before bedtime. Reduce or avoid the intake of foods which are particularly rich in fats. Okay. Avoid too hot or too cold food, and drinks also. You can take herbal drinks which is like cool also, little bit, not too much. Avoid the intake of large amount of liquids during meals, but sip them slowly. Okay, water throughout your day. Eat slowly and chew well your food. Avoid wearing very tight clothing or belt while eating the food. And if you have suffered nighttime reflux, okay, some people are getting reflux of the food, so it is advisable to slightly raise the headboard of the bed and avoid snacks before the bedtime. Very light food like dalia you can take, very light. And also at least give 2 hours or 1.5 hour of gap before the bedtime. Avoid exercise immediately after the food. In case of overweight or obesity, it is advisable that gradually reduce your weight and waist circumstance through a balanced diet associated with regular yoga practice. Thank you so much. I hope these things are very beneficial for the people, those who are dealing with dyspepsia. Thank you for joining it.